Welcome to episode number 73 of Leaders in Healthcare featuring Chris Carvalho. Chris is a strategic digital health consultant with over 15 years of experience and the current board chair for Digital Health Canada. Today we'll hear him share his vision for Digital Health Canada and the future of healthcare, plus hear some incredible stories of successes and failures from within the trenches of change management. Tune in to learn how large organizations like provincial healthcare systems approach technology, AI, and innovation, and why things aren't always as simple as they appear.
And how do you take something that's very complex, try to simplify it, and then get people to adopt and use it? Kind of surprising how slow and how risk averse we are in actually implementing and utilizing a lot of these digital technologies. Or
don't use those icky words around here. You get me kicked out of a medical college.
Digital Health Canada is a not-for-profit. It really is the industry association for anybody that works in the digital health space. So it's probably the most real conversation we had about some of the challenges and opportunities that are in our space right now. It takes a lot to make those system-wide changes, and some risk has to be involved in that, which is tough in our line of work. I actually didn't think I probably answered your question, more rambling on thoughts there, but
that was some really high quality rambling. Thank you. No, that was good. For anybody who's not familiar with the organization, like, what is the big picture mandate for DHC?
Yeah, for sure. So Digital Health Canada is a not-for-profit. It really is the industry association for anybody that works in the digital health space. So a pretty broad membership base, but we have everyone from clinicians, academics, private companies, organizations like health authorities, hospitals, healthcare delivery organizations, really anyone that plays in that space, as well as anyone that's part of their various levels of their career journey. So early stage all the way to very senior people. But the mandate really is to help with the growth and development of individuals within the digital health sector.
I mean, the technological revolution just seems to be lagging in healthcare. So I'm glad we have capable people helping to push this from the back end.
Yeah, I think that's a nice way of saying it. It's amazing, we're in the business of doing a lot of these things that are so groundbreaking in healthcare, yet it's kind of surprising how slow and how risk averse we are in actually implementing and utilizing a lot of these digital technologies, or sharing of information to improve the way that things are going. So lots of room for opportunities there, no doubt.
And so what does membership mean for your average clinician? Like, I'm assuming it's a lot of pharmacists, a lot of primary care doctors, a lot of like health administration type people, primary care networks and divisions of practice, stuff like that. Like, what's the main thing that they're looking for when they come to you guys?
Yeah, so we've got a few different pillars that we typically support. So networking and events is definitely one of those, just to bring the community together. And we do that in a variety of ways through regional events. And now we actually have those almost in every province, which is exciting that there's enough of a push there, but really gives everyone a way to get to know their members of the community. Education is another area and resources is another area that members can leverage. Lots of resources online for what's happening in the digital health space, different courses they can take, as well as some knowledge sharing opportunities like our webinar Wednesday, where you can log on and you can hear from one of our members or partners on a project that's occurring. So I'd say those are probably the two biggest things that people come for, is really the network and connections, and then the knowledge and education of just what's happening and how to progress in a career in the digital health space.
And then you guys just wrapped up the big annual conference a few days ago. How did everything go? What was the feedback like?
Yeah, so another successful year, about 1,500 participants. That was in Toronto.
Nice. Wow.
So typically we bounce back and forth between Eastern Canada, Western Canada. This year was in Toronto. As I said, it was our 50th year, so it was actually pretty special. We were able to bring back a number of the past presidents and invite them to share in the president's reception and welcome them back, and just recognize the volunteers that have been part of building the organization into what it is today. Another great conference in terms of the speakers and presenters that represented nationally, as well as a strong showing from all of our partners, which is great considering that this is a fairly tough time for many from a financial perspective, just given everything that's going on, as well as all the changes that are happening across the healthcare system. But we're still able to get great representation and input and attendance from all our members.
Any highlight reel moments from the event this year in terms of the seminars and the speakers?
Yeah, so I probably am the worst person to ask. I spent most of my time walking around the exhibit floor, just meeting with our partners and sponsors and hearing what they had to say. The one that I was able to attend though was the host plenary session. There was the eHealth conferences, Digital Health Canada, as well as Canada Health Infoway and CaiHi. So the CEOs from those organizations were on stage with a few participants from various sectors. There was probably the most real conversation we had about some of the challenges and opportunities that are in our space right now. There was the CEO of Femtech Advocacy Group, and she was really holding everyone to account to say, like, we've been doing things this way for a long time. How do we actually start to make changes so that we can, be responsible stewards of data, responsible implementers of AI? And I just appreciated it because it was, like I said, a very real and transparent conversation where I feel like a lot of times everyone is pretty cautious on what they say in front of a large crowd. And I think, she brought a very real voice to help us make some changes in how we're looking at implementing some of these new tech.
What is the consensus in general in terms of the opportunities for digital health and innovation and adoption across the country? Like, where do you guys see the most benefit to be gained?
I mean, I think in almost every area, to be honest, but I think it's also for me at least, maybe taking off my Digital Health Canada hat, not to speak for the organization, but personally, I think it's starting to look at digital health as it's already there. So we shouldn't be trying to think about it as something new or innovative. It's like those are the tools and things that are already in place. Let's start thinking about how we improve the system, knowing that everybody is already familiar with that. We still have to be careful about, the privacy, security, use of AI, like all those things that everyone is concerned about. But I think we spend more time trying to make it seem like it's this new innovative thing when really it's just part of our daily life. So, I joked around saying like we probably should change our name where it's not like Digital Health Canada. It's just we can't really use Health Canada, obviously. But it's like
That's
digital is
taken.
just right. You think it's taken exactly, but it's part of the everyday. So how do we stop making it seem like this thing that is somewhat unattainable because people are using it? And I think if we just start looking at it in that way, it may be easier to adopt and implement.
Attracting top healthcare talent is crucial for providing exceptional patient care, but connecting with the right professionals can be time-consuming and complex. Cherry Health bridges the gap. Our network allows you to showcase your organization, post jobs with precision and ease, and directly engage with healthcare providers actively searching for roles like yours. Whether you're an ambitious do-it-yourselfer or a seasoned recruiter, our intuitive web platform makes it easy to showcase your open roles and organize your applicants. Need a more personalized approach? Cherry Health Staffing Solutions offers dedicated recruiters to find and vet the perfect candidates for your specific needs. Build your dream team with Cherry Health. Visit www.cherry.health and start growing your team today.
What's been like the biggest wins or success stories from the digital addition to health?
I mean, I think you can see like things that happened through COVID, just the willingness to utilize some of these different technologies in a way that is not that innovative, to be honest. Like the ability to provide virtual visits wasn't a digital problem. It was we didn't have the right fee codes or processes to support that. So I think just using some of these things like other industry has probably been the most impactful. I know there's probably lots of examples of some very sophisticated tools and technologies that are implemented that do way cooler things than that. But honestly, it's just using it in practical ways that I think just demonstrates how easy it is for us or how easy it should be. Even my kids, like when we talk about like digital health, they're like, we just see the doctor online. Do we have to go in? So the shift in like generation is expecting that that's just part of the everyday. So just thinking about it in a simple way, I think and demonstrating how easy it actually can be if there's a willingness is probably where the most impact has been in the last little while.
It's interesting, like the example with the virtual care visits, right? Like I feel like healthcare has very long been, I guess, like the workflow operations driven by the providers in the community, right? And because it's this public payer system, there hasn't been that much financial incentive to
Sure.
listen to customer feedback and patient concerns and like, oh, booking a half day off of work to go do my blood pressure check and get a refill is pretty inconvenient. And like you did now, yeah, the billing codes and COVID forced everything to be seriously looked at again. But there's nothing, we've had Zoom and we've had Skype for years and years and years prior to COVID.
Yeah, I mean, you're a physician. I mean, I would be curious on your thoughts on where it is now and why it took so long, because it doesn't seem like it's that hard of a problem to solve. But and I get it's not for everybody, right? There's certain cases where virtual and in person definitely are a better fit, but it can be done. We've seen it now. So yeah, curious on your thoughts from the physician side, how it's changed the way that you operate.
I've been like exclusively virtual for my part-time actual medical practice the last several years. Right from like I think early COVID or right before COVID even happened. I was working with TELUS back when it was Babylon.
Okay. Yeah.
So yeah, I was one of the I don't know, not the first ones in there, but definitely one of the early
Sure.
doctors doing it. That was just super convenient. People love it. You're just so much more accessible, like out in the rural parts of the province, people who
Yeah.
aren't as mobile, people don't have the luxury of scheduling things differently.
Yeah, absolutely. But I mean that even the way that you're practicing or new grads are practicing is going to fundamentally be changed by the introduction of these types of technologies. So I think we're part of our challenge is we're always thinking about fitting it into this old way of working or the historical way of working. And I'm excited for the sort of the next generation to come up and question a lot of that stuff to say like, guys, it shouldn't be this hard. We're used to being connected virtually. Let's figure out how to do that.
Well, I think you're going to be a great example of this, right? Like just part of the generation going into the administrative side of things that have been, tech forward most of their lives, right?
I hope so. I mean, I think there's a lot of people out there that have seen what can happen, especially, with a crisis like COVID. I think the risk though is that we end up going back to do things that are fall back in because it takes a lot to make those system-wide changes and some risk has to be involved in that, which is tough in our line of work. And as you would know, it's like risk tolerance is like, okay, zero risk. That's hard to innovate and implement new things if that's the way that our system is used to thinking. But I think we're at a bigger risk if we don't do that, just given all the challenges that we're currently facing.
It's weird to think, like just hearing you say that in my head, I'm like, yeah, why is healthcare so risk averse? But then anytime you think about medications and pharmaceuticals, there's 100 different risks listed that you have to cover with the patient and make sure that
Yeah.
everyone's informed and making a good decision there. But like when it comes to tools, computer stuff, technology, data privacy, suddenly everyone is very, very, very risk averse.
Yeah. I don't know. I mean, I think it's just more of like everyone says, like a people problem, right? It's sometimes easier to identify those things and the reasons why we shouldn't do something as opposed to why we should. It's easy for me to say I'm not a clinician. I don't see patients. Everything we're doing is hopefully enabling, that patient provider experience. You would probably have, different thoughts on why that risk tolerance needs to be, at a certain level versus someone like me that's outside of the exam room. But I think there has to be more of a happy medium to get us there.
Well, it's just now that I'm thinking about it, right? Like you're in the pre-operative anesthesia clinic and you're going through the checklist in the algorithm with the patient. So you're like, yeah, there's like a 2% chance of death if you go through with this procedure, right? Like it's low, but it's not zero. But then when
Sure.
it comes to the, AI and scribes and stuff, like, okay, well, what if somebody got a transcription of this call? And that's just like, okay, this is an
Right.
absolute no-go zone. Like that cannot happen. But the 2% chance you die getting your hip fixed or whatever was going on, like that's seen as the acceptable line.
Yeah, I mean, but I guess other industries do that. I don't know what the last time I went on a plane and I took a look at the stats related to, incidents there, but like we do take risks in similar kinds of situations. Yeah, it's an interesting question for sure. What is that? What is the right balance? Like, how do we move things forward while still making sure we're doing it in an appropriate way?
I mean, when it comes to the digital adoption, the innovation, there's sort of like the I don't know, the sexy, the glamorous, like AI, I feel like has monopolized the conversation for the last 2 years
Oh yeah.
straight here. But then there's the, kind of just let's catch up to the rest of the world and do virtual care and, medicine accessible through the computer. What's next after this? Are we still very much dealing with AI, or is the conversation starting to shift towards the what else?
I think we still are dealing with AI and even knowing how to safely and appropriately roll that out. I think maybe this is an example of how other industries are actually going to move healthcare faster because I mean, every company now that has a digital play has some AI component. So it's probably already way farther down the path than anyone even knows how to stop. But we still have to be careful to make sure that it's actually appropriate use and still safe and secure and representative of the populations that we're serving. So AI, I think, is going to be top of conversation. When I think about where some of the things are, like in my business and a lot of the startups and stuff that I talk about, the areas that I think have the most ability to impact the way care is delivered are not the sexy things. Like you said, everybody wants to go there. They want the new AI tool or the shiny, widget or whatever it is. But it's some of those very basic things that are integrated into clinical workflows that just make it easier for patients and providers to operate, or the ones that are going to get adopted and also save us the most time. But they're definitely not the things that are going to make front page news on this new tool or tech was implemented, because it's the unsexy stuff that actually probably will make more of a difference.
And then, just like in the green room before we got started here, you were mentioning, part of your role as president and board chair for DHC is just determining the strategic direction for this next 3 years. What are you thinking in terms of this upcoming cycle? Like, what are the big things that you guys are looking to touch on?
Yeah, so we haven't had, too many conversations yet on that. That will be the work of the board collectively over the next little while. But I think there's opportunity that we have been talking about in terms of our role as thought leaders and advocates for the industry. That definitely is somewhere where we're going to be able to focus a lot more. Also on the academic partnerships is an area that I know that Sheila, the new CEO, is certainly passionate about. I think just given how much information is out there, how many new schools are popping up that are trying to support digital health or health informatics programs, we have to make stronger ties to, as we talked about, that next generation, to help them understand how they can get into the industry and they can progress and also influence the conversations that are occurring. So those are the things that we've started to throw around. Obviously, there's a whole process around engaging the membership to make sure that they are aware of the strategic refresh and getting their input, because ultimately the organization is there to represent the members that are part of it. The board members are just, voices of the members, but we need to make sure we go and do that consultation to ensure that it actually is hitting what our members want.
And then what are those skills? You mentioned a little bit about the health informatics. What are the skills? What are the training, the education that's going to be critical for this next generation of healthcare professionals to pick up in order to facilitate the digital transformation?
Yeah, that's a good question. So from a Digital Health Canada perspective, there is content there that helps give an overview of the Canadian landscape, because if you're working in one province, you may not actually have in-depth knowledge of how the other province operates. There's also the like the CP HIMSS credential. CP, I always get the acronym mixed up, but the Canadian version of the HIMSS exam, which Digital Health Canada administers, that really just demonstrates like a baseline knowledge and understanding of the health informatics space. So that's always something that's great. But the soft skills are also equally important, and just understanding how to interact with people. I think most of the members that in some way, shape, or form are involved in like the, whether it's design, implementation, plan, adoption. So how do you actually communicate and listen, observe, understand, and then translate that into something that is tangible? That's where I probably spent most of my career, is on that implementation adoption side. So, but the soft skills are those that are just as important as understanding how the tech all works together.
Tell me a bit about your career just as a change agent and project management professional, doing some of those transformative projects, onboarding, doing the EMR adoptions. Like, what have been some of the coolest things you've worked on with clients?
Yeah, so I've been very fortunate to have been, probably just in the right place at the right time. A lot of the career to just get the opportunity to work on many of these things. The short version is I've been in the consulting space most of my career, which leads to those kinds of opportunities. So just by virtue of the way that world works is you're brought in for special projects that are at risk, or a client is looking for a certain skill set or expertise for something that can be transformative. Early in my career, I worked for a company that had a very good reputation in getting involved in a lot of those things. So early on, one of the neatest things was just helping develop or documenting the strategy for Alberta right before AHS formed. So we were going out and talking to Capital Health Region and Calgary Health Region and RSHIP, like the remote or the rural and remote groups, and then AHS formed, and you kind of get a sense previous to what happened there. And then I also worked for POSP, the Physician Office Assistant Program, on contract, as well as PEDO, when doctors were transitioning from paper to electronic. So I got to see that shift, which was I learned a lot for sure. Yeah, different. Right time in the career where you're actually seeing how a very well thought out, let's say, in many cases, process from paper to actually having to go through that change to something that was totally foreign. And then even being part of implementations later on that went from like electronic system to electronic system, being able to compare those two was pretty neat. So I did, probably 75 plus clinics of various sizes. And then more recently have been part of the, through COVID, the vaccine passport rollout, which was a totally interesting project, but then also working with a lot of startups and just understanding their commercialization path and how they actually match their product to workflow and, trying to demonstrate their value proposition. So I've got all kinds of random experiences that I've been lucky enough to be part of, but a lot of it is sort of grounded in how do you take something that's very complex, try to simplify it, and then get people to adopt and use it and figure out a way to show how it'll actually improve, what they're used to doing.
So what is the hardest part of change management when it comes to technology like that?
The hardest part is that I think, honestly, people just expect too much of the technology. Like the tech usually is the most simple part of the entire process. So, in our practice, we always talk about like the people, the process, and the technology. I'm sure most consultants and organizations have some variation of that process, but the hardest part is making sure that the first two are actually understood and agreed to and documented and communicated before the tech actually comes in. It's much harder if there's a technology that everybody thinks that they want to use, and then you try to figure out, who's going to do what and the process around it. So that is probably the hardest part, is people put too much faith or expectation into what tech can actually do, when it really is still the people in the process side that'll impact how that technology is used.
Are you a healthcare professional ready to take the next step in your career? Do you dream of a role where you truly make a difference in a community that's perfect for you and your family? Well then, let me introduce you to Cherry Health. Our platform puts thousands of healthcare opportunities right at your fingertips. Explore jobs by location, specialty, compensation, and more. All on an intuitive map-based platform, available on Android, iOS, or your computer's internet browser. Create your professional profile for free and get started messaging directly with employers. Beyond the app, Cherry Health also offers personalized, white-glove recruiting services who can guide you every step of the way. Your dream healthcare career is just a click or a phone call away. Visit www.cherry.health to start the next phase of your journey.
And walk us through the process. Like, how does a large organization like AHS even decide upon some of these like very, very transformative projects in the first place?
I mean, maybe we'll use like a hypothetical organization, so you don't get me into trouble here.
Sure.
Here, Jordan. But I think sometimes unfortunately, it's not necessarily what's needed. It's political priorities end up dictating things that have to happen. So as long as there's alignment there, that sometimes is how decisions are made. In some cases, it's based on end of life products or the loudest voice. But we hope that these decisions are made based on priorities to the organization that are thought out and ultimately align with how they improve the care that's happening. I don't know if we always do that in the Canadian context just because of how our system is set up, but we would hope that that's how organizations are looking at it. And also it's the like the funding cycles. It's these things are very expensive. Even if we look at not to talk about organizations, but even if we look at like the Connect Care rollout, I remember being part of the first phases before it was even called Connect Care in the Edmonton area, rolling out Epic, 15 years ago. And to think how long it took to go from selecting a system, aligning on priorities, changing the name, getting everybody behind it, changing process, setting up teams, all those things. Like they're 15-year projects. So a lot of times these things are started with one thing in mind and probably morph 3 or 4 times. And then the procurement cycle sort of adds to that. So I actually didn't think I probably answered your question, more rambling on thoughts there, but
that was some really high quality rambling. Thank you. No, that was good. The one thing I want to follow up to that is just like, why does it take so long? Like for us, from our perspective with Cherry Health, we're like working from the bottom up of like getting individual users and individual clinics online and onboarded and changing their processes around. But like from my perspective on that like ground swell route, it just seems like things would be so simple if we could just mandate everybody do the same thing all at once across a region or a province. Like, how does something possibly wind up taking so many years or decades to like do a new system or a new program, or like how does that even happen?
Yeah, I mean, I think getting to the point where somebody is willing to mandate it is tough, right? Changing leaders, changing priorities, changing government, changing fiscal situations. So if we look at Alberta, and I think it's safe to say like Connect Care was a long project, but ultimately I think they were fairly successful in being able to do that for an entire province. That took a long time though, right? To get everybody on board and buy-in and implementation. But that's an example of if you stick to the priorities and say yes to things that align and no to things that don't, it can be done. It's hard to do that when there's so many competing priorities in the healthcare system. Like where is the right place to invest and put that money? Having spent time like in a similar situation when we were going out and selling EMRs to each doctor's office or each clinic, that can be painful, but at least they have a mandate to roll something out in their area. So from a startup side, that can definitely be harder because you're selling to thousands of customer, and ultimately the goal is like, can we get one big whale of a customer that solves everything? I don't actually know if healthcare is set up that way, and I don't know if realistically we can do that just because of how our jurisdictions operate.
Well, I guess like anything that's going to extend beyond the 4-year, 5-year election cycle, now suddenly you got to have bipartisan buy-in on things. You can't just count on one government wanting things to go through and their goals and values being consistent a couple years later. The funding cycle, it gets complicated quickly, hey?
It is for sure. And I read there was a post on LinkedIn, I think it was a gentleman from the UK, and he was talking about like exactly that question, why is it so hard? And I think it's probably seems harder because we try to compare healthcare to other industries, but it's not the same because and he was comparing it to like a traditional like SaaS company. It's like you have your product and you sell it to your customer. It's very straightforward. What does your customer want? They're the ones that make the decision to buy it. They're the ones that have the money. It's a one-to-one. In healthcare, we treat it that way, but in a lot of times it's who is the customer? You got maybe government that puts funding in or sets priorities. You've got a variety of health authorities, depending on where you are, that have their decision-making process. You've got the clinicians that are probably going to be the ones to use it that have some influence. You've got patients that are involved. You've got IT. You've got procurement. So it's just a complicated process. And I think if we understand that and start looking at it a different way, maybe 18 months isn't as long as it feels, because it just takes time to work through that. Now, I'd love to see it happen much faster than that, but we also got to be realistic.
And so let's dust off your crystal ball for a moment here. Like 5 years down the road, what's the best case scenario for Canadian health systems?
Oh man, now you're trying to get me in trouble here, like we talked about before, right? I think that you're going to see some things pop up more at like the grassroots level. Like even here, we're seeing more private clinics that are partnering with the public system. I think patients are going to be forced to take things into their own hands, and we're going to see players from outside of healthcare trying to bring their experience from other industry to offer services to customers. How that fits into the way that the compensation model works out, I have no idea, but I think the system will be forced at some point to adapt to operate more like other industries. I know we always look to see like what jurisdiction out there is providing healthcare in the best way, and I don't think there is one that we can point to. This is like totally has it figured out, but we can probably look at what other industries are providing complex services in a complex way to multi-stakeholder customers. I think that's where we can start to look at bringing improvements into the system. But it'd be great to see something happen in the next 5 years for sure.
Oh, definitely, definitely. I guess what advice would you give to the average healthcare professional in terms of helping facilitate change and innovation?
Yeah, I'd say be open to changes. I think we all are very good at continuing to do things in a way that brought success, but just because it's different doesn't mean it's wrong. So be open to looking at different ways of operating. I think also, sharing feedback and being willing to take some risk is going to be important. Again, it's not always easy depending on where in an organization you are, what role you play. But I think the more that we build that culture within our healthcare system or in our innovation system to recognize that like trying things out in a safe way, and if it doesn't work, that's all right, but just move on quickly and try something else. I think if we start to build that attitude, it'll definitely go a long way.
Yeah, just less risk averse. Not no risk aversion, but just
Not
maybe a
no
little
risk.
less. A healthy decrease.
Yeah. And I think on that, instead of saying like why it won't work, let's think about why it might. I think even just shifting that mindset a little bit as well as may just help to have the conversation to move things forward.
Yeah, there's a lot of pessimism, I guess, in healthcare too, and skepticism.
Definitely. I mean, I've worked across other industries, and I'd say healthcare definitely has a healthy dose of that. Probably because in many cases, you're dealing with life and death. So understandably so, you got to keep that in mind. But I think in a lot of cases, it's also easier to shut the conversation down to say, this won't work because of this, as opposed to, okay, I could see here, maybe it takes funding or, realignment of priorities. Those are hard things to do sometimes. So, and in a busy world, it's sometimes easier just to manage workload by saying this won't work or being pessimistic. So I think we could all probably, change our attitude on that kind of stuff.
Yeah, we need a little more optimism, I think, in the field. And then everyone should join Digital Health Canada too, obviously.
Everyone definitely should. I think there's a healthy dose of optimism through the events and groups that you get to meet. So yeah, thanks for the plug on that.
Well, I mean, it's important, right? I mean, you yourself have been a big proponent of community building for a long time. Like, what's the logic behind that?
Yeah, so I mean, I think we can't do anything on our own, and it's always way more fun and way easier to do work with people that we know and align to. I think if we also have a healthy relationship with our partners, regardless of which industry you're in, it's easier to have some of those tough discussions and solve those hard problems. So, I mean, I've been a member of Digital Health Canada since, I first started in the field, and I do definitely try to go to other organizations like that, whether it's the innovation ecosystem or digital health or tech. That community is important because if we're all comfortable enough to have those conversations and we trust each other and we have that relationship, it's much easier to dive in and make change. So groups like Digital Health Canada luckily have a national voice, so you also get different perspectives. But the community is probably my favorite thing about the industry too, is it's pretty small. Like we're lucky that Canada's not, it's geographically big, but the people side of things, especially in the digital health space, is pretty small. So even going to e-health, it feels like a like a family reunion. You really do know, and you can connect with a lot of people that you've done work with.
It probably really goes a long way to like helping foster the optimistic seeds that are getting planted across the landscape here. Like you go to these events, you talk to the people who are early adopters, who are out of the box thinkers, and it can be contagious.
For sure. Yeah, and there's definitely some people that have a reputation of like bringing that energy, and you can see people want to go and talk to them, and it's contagious. So the more we can bring people together and share those good stories, the more hope we have for others in the space.
Let's name drop for a little bit here. You alluded briefly to some of the startups you've been working with the last couple of years. What's cool that's getting you excited these days?
Oh, geez, I'm gonna miss somebody, and then someone's gonna be upset. So I've been spending a lot of my time in the age tech space, and we talked about building community and taking risk. And there's some long-term care providers that are starting to think about different ways of offering services to individuals to stay in their homes. How do you take the pressure off the system if someone's waiting? So Broadmead Care, they have been a client, so full disclosure. But Derek, the CEO, he has just built this culture of innovation within an organization that I'd say was maybe not as far along their innovation path. And then it started to intake a number of technologies through support from the ministry to build a long-term care at home program. So there's been some really interesting groups there. Chirp fall detection software that does like passive monitoring and two-way communication. There's another startup called Tuck2 that they're using as part of their service, which is basically like an Uber for home care services, companionship, medical transportation, loneliness. So that's been an interesting group. Who else is there? And then we've been looking at other types of technologies. There's another group, Medicube, which is a medication dispenser, holds up to 16 medications, and then a caregiver, mostly catered to like older adult children that have a older parent. You can actually manage their whole medication schedule as part of this device that stays in the home, so you're not having to go in there every day. So there's lots of different things that, again, none of those things sound like groundbreaking, but they're solving simple problems that make people's lives easier and take some burden off the system. But those are a few examples of ones that we've been working closely with over the last little while.
That's super cool. Now we're gonna have to edit some of those out for timing purposes on the final episode here. But I mean, it's really interesting how some people are approaching these things, like Uber for compassionate care and loneliness. Just having grandparents, aging right now. Like some of these things sound super cool.
Yeah, and that's actually like a whole industry that's kind of popping up as well as people, our age probably, and 10, 15 years older, that have their parents that they're maybe not in the same city. They realize that the healthcare system maybe isn't set up to support the needs of their aging parents. So they are looking for these types of technologies to make their caregiving role easier. And it's like there's a whole industry around that, which has been fascinating. And I've been spending more time in that space just to get a sense of what's out there. And that I'd say is probably the most, from a startup perspective or company perspective, that's the most direct to consumer like health play you can probably get is in that world, because they also have funds in many cases to pay for those things for their parents.
What's the potential for things like that through that path to commercialization to then get widespread systemic adoption or start having partnerships with the health regions? Like, how does that typically go?
Yeah, I mean, that's the minute that you take it from direct to consumer to the health system, you run into very similar challenges, right? Procurement, 18 to 24 months minimum. But even before that, it's trying to demonstrate the value and the efficiencies that these upstream types of initiatives will actually have on the system. It's really hard to show that if you put a medication dispenser in someone's home, that it's going to save the system, X number of dollars in 5 years. So I don't know how that will play out yet. And I think that the good thing is you're starting to see government organizations start to get interested in these different projects that are launching in that space so that they can start to figure out how and if they actually provide funding for that. We don't really fund prevention in any way. It's more, what is the service that you need right now? But I think things like this, just because of the aging population and the stress that they're going to put on the system, there's more interest in taking a look at the preventative side of things. So it'll be an interesting few years for sure.
Has Digital Health Canada thought a whole lot about just the private public partnership in terms of the dollars and where the funding comes from?
So, I mean, we typically haven't played in that space in terms of how the system is funded. Like Digital Health Canada is set up to be more of a like that industry association to represent all voices that are part of that system. I think though there's probably work that could be done from an advocacy perspective if there was a good model or a white paper that could be written. I think in a lot of the work that I do outside of that, we're trying to work with clients to make a case for public-private partnerships. So I'd say some provinces are definitely farther down that path. Having worked in Alberta and a lot of the work is there, I think they've figured out a really interesting way of leveraging private dollars to influence the way the public system is operating and unlock dollars to try some of these innovative approaches. BC is maybe not as far down that path, but definitely they're starting to think about how that could look. And every province is probably slightly different that way, but I think we have to, right? Our private partners want to be good corporate citizens and help. If that leads to revenue and sales, okay, that's great. And maybe we shouldn't look at it as being, as bad as it might seem in the healthcare space. But there definitely is more openness, at least in the conversations that I've been in, to figure out how do we do that.
There's sort of just this weird, like, medium-sized business phobia in Canada. Like, yes, small business, mom and pop shop, a pharmacy, a clinic, a doctor, a chiropractor, that's all good. But then as soon as you start getting into like, okay, now we've got a chain of things, or we've got, now it's enterprise, and there's sort of this like disdain in Canada. Like, we don't want to be like the US. And I think that really does hinder things.
Is this why you were stopping me from calling you more than a startup?
Don't use those icky words around here. You're going to get me kicked out of a medical college.
Yeah, it is interesting for sure. Like the minute that people start thinking about like monetization of healthcare and a certain size, there is a negative connotation. Totally. Startups good, do some pilots, nothing too big, or it's these massive organizations that are already in that space that people are saying stuff about anyway. So I think that's one of the areas that these new sort of sub-industries are going to start to solve, because I think people are just going to be more open, like consumers or patients are going to be more open to, finding these services on their own, and they're going to have to like pushing the system to have to adopt. That'll just take time though.
Well, I appreciate the thoughts, the insights today. Last chance to plug your pluggables.
Hug the pluggables. I mean, we talked about Digital Health Canada. I think it's a great way for anybody that's in the space to get connected to an amazing community and leverage the resources and network and educational materials that are there. So definitely check that out. I'm happy for anyone to connect with me through LinkedIn, anything in the innovation, commercialization, digital transformation space. Especially companies love finding out, who's out there, the kind of work they're doing, and then figuring out a way to actually connect them into the system.
I've been helping out with the scientific advisory committee a little bit on planning out the webinar Wednesdays. So in my completely biased opinion, I highly recommend everyone come check out some of our webinars.
I heard a rumor that you were on there, so thank you. That's great that you've been able to get involved.
No, it's been fun. Awesome. Well, Chris, thank you so much for joining us today. Really appreciate the thoughts.
Yeah, this was a lot of fun. Thank you. Appreciate you having me on.